Hi everyone! In this video, I want to talk about 3 signs that one might have endo belly. I'm Vivian, and I've been solo traveling around the world for the last 10 years and lived the last 15 years with severe bloating, especially after eating. On this channel, I document what my travels have taught me. And that means here I'm documenting my own journey from letting other people just tell me it was all in my head to becoming truly healthy. Like I said, since I've been a child, I've been unexplainably bloated, especially after eating, and it's gotten worse as I got older. I spent about $10,000 total on trying different treatments, seeing different doctors, normal Western doctors, less traditional naturopathic and functional medicine doctors, and traditional medicine doctors from the East. This was all to try to solve my stubborn bloat that just wouldn't go away. And I finally figured it out. I just want to give a quick disclaimer and say that I am not a doctor or a healthcare professional. I'm just a patient trying to share my own story and hoping someone else with the same questions in their head or with some health mystery doesn't give up or hears something that helps them. The first sign of endobelly is chronic bloating. Endobelly is extreme bloating that's caused by inflammation from endometrium-like tissue growing on the intestines. This condition where tissue similar to the inside of your uterus is growing outside of the uterus, and it should come out every month as your period, but it's not. That's called endometriosis, and that can only be diagnosed through surgery. But there's a lot of indications, like obvious indications when a woman has it because it's so common. So endobelly can happen to patients of endometriosis. Not all of them have it, but some endometriosis patients might have endobelly. This extreme bloating can be caused by this tissue growing on your intestines and over time becoming more and more inflamed. It can be coming also from cysts that are formed from trapped blood because the endometrial-like tissue has nowhere to escape. It can be caused from gas trapped inside your intestines because your microbiome of the gut is not balanced. So the bugs inside all of our guts are out of balance and healthy foods are fermenting earlier in the intestinal tract and just causing a bunch of gas to be trapped. It can be caused by water retention from all this inflammation. It can be caused by the colon being pushed forward while the uterus is being pushed back because the disease misaligns your internal organs and causes them to stick together in what's called adhesions. So your intestines might stick to your uterus, or your ovaries and uterus might be stuck together. And other digestion issues could also be contributing to this overall more bloated look. When I say bloated, on a bad day, I can look 5 to 6 months pregnant. And another side to this is that no one really believes me because they see me up and active and surfing and sometimes wearing like a bikini or a crop top and not looking bloated. But we know our own bodies best, right? So contrary to popular belief, endometriosis is something that you're born with. It's not from retrograde menstruation or backflow of the period blood back up into the other organs. It's a condition you're born with. It's highly genetic, and endobelly itself can start around 8 or 9 years old when your hormones are changing far before you have your first period, like in my case. I remember I always kind of had a little pooch, a distended abdomen after I finished a meal, especially if it was healthy and high in sweet fruits like mangoes, pineapples, or watermelon. My family members noticed and commented on it, but they didn't realize that something was seriously wrong. Throughout my childhood and 20s, it almost felt like eating healthier foods made me feel worse because they made me more bloated, and eating junk food didn't really bloat me. I remember once I did a Krispy Kreme donut challenge with a friend where we ran 3 miles, we ate a dozen Krispy Kreme donuts each, and then we ran another 3 miles. And I felt great because the white flour and deep fried donut was highly refined and not complex for my digestive system. And that felt a lot better than eating a salad. I would definitely not feel as good if I did it now than when I did it out of silliness almost 10 years ago. This bloating and appearance of being pregnant worsened over time. Sometimes I felt like I would wake up and feel flatter, and then I would drink a glass of plain water, and then the bloating would just be more apparent. These days, I don't fit into normal clothes. I really feel a difference when I feel like the rest of me is the same size and I try on a pair of jeans from years ago and it's not buttoning the same way. And I'm directly reaching for the maternity line for a lot of bottoms when I shop, such as underwear and shorts or loose-fitting, bloat-friendly maternity kind of dresses. About 2 years ago, someone stopped me on the street in Vietnam and said, "Do you have a baby in there?" and pointed to my belly. And that day I was feeling very good and very relatively unbloated. And instead of even being offended, I was actually so validated, and I was so happy that someone else could finally see what I was seeing instead of just telling me I look fine, or they sometimes look like that too. So something we can do when we're feeling this bloated is called the I love you massage, or the ILU massage, and I'll link that in the description because I can't really show it at a desk, but I'll link what to do. It's very simple and quick massage to help move things through the intestine. The second sign of endobelly is painful periods. I would say pain and painful periods is the hallmark of endometriosis, and it's the most cited main symptom of endometriosis alongside the other symptoms that may or may not appear if you have the disease, including constipation, pain during or after sex, general pelvic pain that can be in the middle of the cycle or during the period. So it can happen when you're having your period and when you're not having your period. Heavy bleeding, symptoms that feel like a UTI, like the burning sensation when you're peeing, but you're actually not having a UTI, you're having bladder problems, and I'll link a book down below that will cover that. If you go to gynecologist and complain of that, but the test is coming back negative that you don't have a UTI, then be careful that they don't prescribe antibiotics, because if you suspect you have endo, it's important not to take unnecessary antibiotics for misdiagnosis where it seems like a UTI, because then that's going to kill all the good bugs in your gut, and then that's just going to cause more gut problems, and then also a higher chance of a UTI or bladder problems. A final symptom of endometriosis is unexplained infertility, because it takes so long to diagnose endometriosis, and it can be often so invisible as it's the cause of up to 50% of unexplained infertility, which I think is huge and just puts a whole nother layer of severity on top of all the other pressure you feel when you understand you have it. The sad thing is that endometriosis is really common, but we've normalized painful periods. Everyone watching this video, woman or not, has met someone or seen someone today with endometriosis. If you've stepped outside of your house, you've met someone or seen someone today with endometriosis, because it affects 10 to 15% of all women and up to 15% of Asian women. There's a high genetic component. If your mom, female cousin, aunt, or grandma has endometriosis, it increases your chances of having it by 7 to 10-fold. It's not something that goes away. It's something that they were born and die with. If you feel like you have some of these symptoms and then you feel like, oh, your female cousin had this, or you remember your grandma saying she had seriously painful periods, that's a flag to think about seeing an endometriosis specialist. And when I talk about painful periods, I'm talking about severe pain that keeps you bedridden for days, that wakes you up in the middle of the night. It can be to the point where it makes you not able to do anything until you pass out from the pain. But the other side of things is that according to the Endo Foundation of America, 20 to 25% of women with endo have what is called silent endometriosis, and 7 to 10% of women with severe endometriosis report no pain whatsoever. Finally, the third sign that you might have endobelly is if you feel like doctors aren't getting you anywhere. 90% of endometriosis patients say that they've experienced feeling dismissed or disbelieved about their symptoms and their pain. So I've gone to everyone and I just felt like I wasn't getting anywhere. How I actually ended up finding the answers was by reading a book that I will add down below. I was approaching adults as a child about my belly and asking for advice, and some of them were doctors. My aunt is an internal medicine physician, and when I asked her and showed her, she was just like, oh, I get it. Your cousin, her daughter, has the flat body type and you just have the round body type. As a child, you kind of believe that and try to put that away, even though you have this cognitive dissonance going on. That doesn't sound right. Why do I have this mystery? Why am I this 1 in a million case where my body doesn't fit the science textbooks? It's not like in biology class you ever learn about the flat type of body and the round type of body, because it doesn't exist. Other doctors that really weren't getting me anywhere were gynecologists. A 2023 survey by Women's Health magazine surveying OBGYN residents found that only 26% of them were comfortable managing endometriosis surgically, and about half of them were comfortable managing endometriosis medically. Often when you present to the doctor with symptoms of pain or saying, hey, I read this book, I think I have endometriosis, they'll often just take the birth control route. They'll say, well, we can make you not have a period anymore so you won't have pain. And that's exactly what happened to me a couple years ago. And the book Beating Endo, that kind of goes over the umbrella of endo and everything it can cause in your life. That book says that doesn't make sense to just give someone birth control, because the lesions, the tissue growing outside of your uterus is still there. It's not physically removed, and right now there's no other way to do anything except to physically remove it. I'll get to there later. Then I've been to a bunch of gut doctors. I was diagnosed with IBS and heartburn when I had a colonoscopy and an upper endoscopy done, and the doctor, when went ahead and just described me with anxiety because I was asking about parasites and mold exposure based on my research of potential reasons why I'm having this unexplained abdominal bloating. I also did a lot of personal work and worked with a functional medicine doctor on SIBO, or small intestinal bacteria overgrowth, basically an overgrowth of the bugs inside your intestines in the small intestines. And I did all sorts of diets to eliminate carbs and sugars to try to stop my bloating, including the autoimmune paleo diet, a low FODMAP diet, and the normal paleo diet. I was also fasting to see if I just stopped putting anything into my gut, I would stop bloating. And this is very harmful, stressful, and difficult to do. I was so desperate, and I really don't recommend doing this. I recommend doing more research and reading books about whatever you have. What I ended up doing was intermittent fasting with a fasting period longer and longer. And then I just went ahead and tried a master cleanse, which is 10 days of not eating. It's a day of prep. All you do is drink this maple syrup, cayenne pepper, homemade lemonade for 10 days. I was so determined and motivated by finishing the 10 days and checking off one day that I actually did it, even though I was surfing for 2 hours at a time. I don't know how I did it. I even documented the whole thing. I don't recommend it because I shit the bed. It tells you to clean yourself out way too much with strong laxatives. And what it did answer for me though was that I was still bloated despite no food entering my stomach for 10 days. I could still see something. For many people, it might be okay, or I shouldn't worry about it because it's not that big. But for me, I'm concerned because something that shouldn't be happening is happening. And that's my body saying medically something is not right here. I also worked with a gut doctor on a protocol that involved antimicrobials, or basically herbal supplements that kill off the excess bad bugs overgrowing in your gut, as well as a supplement of 120 billion CFU count probiotics per day. And that didn't work. We tried some other things like an enzyme protocol using MSM powder, and after none of it worked, he said, hey, you might really want to go check out more what endobelly is, and that's out of my scope, but I'll connect you to the right practitioners for that. However, whatever was in those multivitamin supplements and all that L-glutamine that the doctor had me on made me have perfect skin. So it was helping the gut alone part that was affected by the disease, but not the bloating part. I was more bloated than ever. Then I've been to some traditional doctors, like an acupuncturist in China who I went to complain about my bloating. He just quickly felt my pulse the way they do at those appointments, and he's just immediately like, you have painful periods, and I can fix the pain over the course of some weeks if you stay here. But I wasn't staying there. That just like stood out to me, and I was like, okay, how could he feel that? Later, when I was locked down in India, I was in Dharamshala where the Dalai Lama is based, and I walk in for a Tibetan medicine consultation. They just touch my pulse and they're like, you have painful periods. And I was like, what is going on? Like, something's really going on if they can just feel it on my wrist. No one ever told me that I had endometriosis. They just put me on a bunch of like herbal supplements. It was like this crazy regime of like horrible tasting pills. And I also had like a 10 days of silence meditation treatment. So I had to like remember all the pills I was supposed to take on top of trying this new meditation technique of 10 hours a day for 10 days at the same time. And it was stressful. And I got my period during that meditation course, and I couldn't focus on the meditation at all. I was just like doubled over in pain. It didn't help at all. These supplements were not helping my undiagnosed disease and the primary symptom of pain, or the bloating. Just to go over everything, if you are a uterus owner with severe bloating that's not explained and painful periods or any other endometriosis symptom, then it might be time to book an appointment with an endometriosis specialist just to talk about everything with them. I can't even know that I have endometriosis. A lot of the symptoms are similar to adenomyosis, and none of that can really be diagnosed and seen and located until you have a minimally invasive surgery. This is all just me doing my studying, repeating the literature as a patient, and being told by some healthcare providers and experts on the subject that they are sure that I have endobelly and that I have endometriosis. Just a quick note, there's 2 types of surgery and insurance, and a lot of doctors will automatically put you on the not good type of surgery that might make things worse and won't really help make things better. So make sure you get endo excision surgery. Those 3 words are very important, and it's a minimally invasive surgery. I hope someone out there feels validated, feels more free to believe in themselves and whatever they feel their body is doing, and not listening to other people or letting other people dismiss them. I hope everyone has a good day.